Is the PRP hair regeneration permanent? What is the difference between PRP and PRP hair regeneration? I am 20 years old and I suffer from genetic hair loss.
Thank you for your question. You submitted a question without a photo, but you're asking a question about terminology. And you're asking first, is PRP hair regeneration permanent? And you're asking, is there a difference between PRP versus PRP hair regeneration? So, and you're asking about the permanency. Well, I could certainly understand the reason for your confusion. There certainly is a lot of terms that are used in this world of hair loss. So I'll give you a little bit of guidance about this. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. And this is a technology we developed which did include PRP, but also includes something called acellular matrix. And it actually evolved out of the applications we were doing originally for hair transplants. So let's start by answering the question about permanence, and this is something that we deal with a lot. To make a long story short, when we developed TrichoStem Hair Regeneration, this is a company that we started based on developing a process called hair regeneration. And the reason we called it hair regeneration is that when we were doing hair transplant surgery, and we would use this platelet-rich plasma extracellular matrix combination and use it to try to help the wound healing of the donor area as well as the hair grafts, we noticed periodically that patients with thinning hair, their hair got thicker. And so it actually became part of a strategy where we would actually combine the two processes so that we would do hair transplant with PRP acellular matrix or hair regeneration. But what I did over time is look at this potential of treating people who have hair thinning without a transplant and to do hair regeneration. So for us, hair regeneration meant a process that included PRP or platelet-rich plasma combined in a very specific way with acellular matrix, vitamin D, and other elements to a total protocol. And so I think that thanks to the popularity of this treatment that we developed, we're treating people from all over the world, and we are essentially popularizing the term hair regeneration. Now, of course, it can also be referred to as PRP hair regeneration, but certainly for our practice and the way we explain our process, we use hair regeneration, or now the company that we developed to try to bring this technology closer to people outside of our 2 offices in Manhattan and Long Island, we call it TrichoStem Hair Regeneration, TrichoStem Hair Regeneration Centers. The idea is that when you think of the word regeneration, it's basically you're dealing with hair that the follicles are deteriorating, and what we're doing is we're regenerating their capacity to grow and to make hair. So I think that what you can also distinguish is PRP alone as a standalone treatment for hair loss versus TrichoStem or hair regeneration. And for us, it couldn't be more night and day. When we were developing this treatment, and in the regular routine of using PRP in our practice, as a cosmetic surgeon and someone who does a lot of cosmetic dermatologic treatment, lasers, injectables, we're trying to develop better ways to help people improve their skin. So we use PRP routinely, every day, all day, for under-eye dark circles, for fine lines and wrinkles, for acne scars, for skin tissue rehab, for helping people with sun damage. We understand that, my observation has been that with skin we're able to get a certain degree of long-term benefit. But when it comes to hair loss, PRP alone can have short-term benefit. You can inject PRP and you can stimulate hair growth. In other words, you can take a hair follicle that's not growing, which is in a resting stage, due to a prolonged resting stage, for example, with androgenetic or male pattern or female pattern hair loss, and you can stimulate growth. But will that hair continue to grow? In our practice, hair regeneration, this combination of PRP, acellular matrix, vitamin D, and the protocol that I developed over several years, we have 5 years of data showing sustainable benefit without repeat injections. There are people that we will do another injection around 15 months. We refer to that as the booster injection, but it is not a requirement. It appears that we can help people who have gotten some regrowth from the hair regeneration of very fine hairs. A lot of those hairs can actually be responsive to another treatment. Now, in contrast, PRP is routinely recommended to people to have it done monthly, or in some cases weekly, and in other cases 3 to 6 months, which means that there's a lot of people who have different experiences and what they feel is the best thing to do for their patients. I have found that sustainability is very important, and patients with hair loss going for a treatment where they have injections in their scalp every month often will get fatigued and frustrated with not knowing when there's an end point and how long can they really keep getting injected monthly. So many of them have come to us to have a treatment we refer to as hair regeneration. So I hope this distinction is helpful to you, and it gives you an opportunity to learn more on how to differentiate PRP alone versus hair regeneration. So I hope that was helpful. I wish you the best of luck, and thank you for your question.